Hello and welcome to this webinar, which will explore our redeveloped qualifications, the Level 3 Diploma in Adult Care and the Level 5 Diploma in Leadership and Management for Adult Care. By way of introductions, my name is Claire Montague and I'm the Senior Subject Specialist for Social Care. I'm joined today by Qualification Development Managers Shuma Hussain and Stephanie Head. However, before we begin, let us take stock. The context of care and support is changing, and of course with that comes key areas for reform. To respond to the drivers, we require an adaptable, competent workforce who are able to instil values central to practice and demonstrate emerging skill sets. The government, in the recent policy paper, People at the Heart of Care, Adult Social Care Reform, has pledged to invest, as a minimum, £500 million to revolutionise the way the social care workforce is supported. The proposed workforce strategy comprises a range of policies to include the development of a universal knowledge and skills framework with identified career pathways to support progression, backed by a linked investment and learning and development. A commitment for and initiatives to promote workforce wellbeing is also paramount. Furthermore, there are plans for the creation of a new digital hub to enable the workforce to gain information, advice and guidance, providing access also to a learning and development portable log. The qualifications were redeveloped in response to outcomes from a consultation held by Skills for Care with the sector. The consultation extensively engaged both stakeholders and subject matter experts. Key themes for inclusion were ultimately identified to ensure the qualifications are up to date and so fit for purpose. Today, we will provide an overview of the key changes for both qualifications. However, as an introduction, areas highlighted for expansion for the Level 3 Diploma were infection prevention and control, digital skills, personal wellbeing, person-centred approaches and safeguarding. For the Level 5, areas uncovered included digital skills, personal wellbeing, supervising, supporting and developing others, and contingency planning. Both the qualifications have received approval from Skills for Care, evidencing quality and ensuring consistency and clarity of the adult care qualifications. I'll now hand over to Shuma, who will provide an overview of the new Level 3 Diploma in Adult Care, highlighting those key changes.
Thanks, Claire, for that really useful context. So as Claire mentioned, I'll be providing an overview of the new Level 3 Adult Care qualification, going through the key differences and similarities compared to the current qualification. Next slide, please, Hayley. As Claire has already mentioned, the new qualification was developed to meet the Skills for Care specification and is largely very similar to the current qualification. It retains the same title and continues to have the same aims and objectives, which develop the knowledge and skills needed when working in care settings. It's graded achieved, not yet achieved, and internally assessed, and of course, it continues to require work placement as a competence-based qualification. As a reminder, the current qualification is due to be withdrawn on the 30th of April, and the new qualification will go live on the 1st of May. Okay, so moving on to the mandatory content. Hayley, if you could move to the next slide, please. As you will see from this list, the mandatory units will hopefully be familiar to you and largely cover the same areas as the current qualification. However, all units have been updated to some extent to reflect any new Skills for Care criteria, provide additional clarity or to remove duplication. Therefore, all mandatory units do have new unit numbers to reflect the new content. You'll also see from the list that some units are emboldened either partly or wholly. This is to show new areas that have been introduced to the mandatory content. For example, the new qualification now contains mandatory subject areas covering professional development, choice and independence, human rights, and new units, mental capacity and restrictive practices, and also infection prevention and control. Again, this is very much reflective of the outcomes from the consultation. Next slide, please. Moving on to the optional units, again, these were all reviewed to ensure they continue to be fit for purpose, and in the main, the majority have carried over into the new qualification with none or some minor tweaks. Where, however, there have been more substantial changes or completely new units written, these have new unit numbers. The new qualification, similar to the current qualification, continues to offer a large range of units, allowing learners to tailor the qualification to meet their needs, interests, preferred progression paths and the context of their job role. There are 91 optional units covering aspects of support, specialisms, clinical skills or healthcare tasks, and leadership and management skills. We've also added in further new units, and you can see some examples listed in the slide, again offering further choice. Next slide, please, Hayley. Moving over now to the rules of combination. The qualification remains 58 credits. However, there are more mandatory credits required to complete in the new version due to the additional mandatory content that I referred to earlier. So where previously learners had to achieve 28 credits from the mandatory units, they now have to complete 39 mandatory credits and the remaining 19 credits from the optional units. So in terms of size, the qualification very much remains the same. Next slide, please, Hayley. The next slide covers digital skills. Digital skills have been highlighted as a key learning and development priority for care workers, and in the list you can see the key themes that emerge from the consultation. The use of digital technologies has been referred to throughout the qualification criteria where relevant to all Level 3 learners. We've also embedded digital skills within appropriate optional qualification content wherever practical and relevant to enable evolution of the workforce. You can find more guidance and mapping of digital skills within Appendix C of the qualification specification found on QualHub. Next slide, please. In relation to the apprenticeship standard, this qualification can be undertaken as part of the Lead Adult Care Worker Apprenticeship. Although it is currently under review, our new qualification, the same as the current qualification, continues to map to this standard. Once a revised standard has been approved, we would look to revisit the mapping and update our qualification if required. The qualification specification also contains a high-level mapping to the standard, which you may find useful. Next slide, please, Hayley. Lastly, I wanted to confirm the funding streams available for this qualification. So the ESFA have confirmed 16 to 19 advanced learner loans and also inclusion as part of the Level 3 free courses for jobs offer. We're currently waiting for Skills for Care to confirm workforce development funding and will communicate this once we have confirmation. That brings me to the end of my section. I hope you found this overview useful. More information can be found on QualHub by searching for the qualification, and this includes resources such as fact sheets, sample assessment tasks, and the qualification specification. Thank you for listening, and I'll now hand back to Claire.
Thank you, Shuma. Stephanie will now introduce you to the Level 5 Diploma in Leadership and Management for Adult Care.
Thank you, Claire. Hello, I will be exploring the new Level 5 Diploma in Leadership and Management for Adult Care. If we could go to the next slide, please, Hayley. I will discuss the key differences and similarities between the current qualification and the new Level 5 Diploma, as well as exploring the new coverage of digital knowledge and skills. Next slide, please. The new Level 5 qualification was developed to meet the Skills for Care criteria and remains similar to the current qualification in its objectives, grading, assessment, and work placement requirements. Like the current qualification, the diploma has been designed to support the development of registered managers of adult social care services. The qualification provides learners with the knowledge and skills needed to work in adult social care and to have responsibility for leading and managing a service. This will include managing and improving care and support for individuals accessing the service, supporting and developing the workforce, and driving the vision for their service or organisation. The qualification will remain internally assessed and graded achieved, not yet achieved. As this is a competence-based qualification, learners are still required to be working in a managerial role. Next slide, please, Hayley. Moving on to further key differences and similarities between the qualifications, we will discuss the mandatory and optional unit content. There are still 20 mandatory units which largely cover the same subject areas as the current qualification. 4 units have seen updates to their titles, and all units have new unit numbers to reflect new and/or wider content. For example, entrepreneurial skills in adult care has been updated to market provision and integrated approaches in adult care, and manage self in adult care has now been updated to manage own professional development and personal well-being. Within the mandatory units, we have covered new subject areas or covered existing subject areas in more depth, reflective of the consultation, such as personal and mental health and well-being, integrated approaches, supervising, supporting and developing others, infection prevention and control skills, contingency planning, conflict management, and digital skills. We will now discuss the optional units. All of our optional units were reviewed to ensure they continue to remain current and fit for purpose. Most of the optional units have minor to no updates and still allow learners to tailor and contextualize their learning. We have added 2 new units covering finance and budgeting and digital skills, again reflecting the outcomes of the consultation. We have now divided the optional units into themes in line with the mandatory units to support ease of identification of subject areas. These themes are aspects of support and aspects of leadership and management. Next slide, please, Hayley. As shown in the table with regard to the rules of combination, we have raised the TQT, GLH, and credit values to reflect new content within the mandatory units. Learners must now achieve 80 credits from the 20 mandatory units and a minimum of 15 credits from the optional units for a minimum of 95 credits in total, whereas the previous qualification required 75 credits for the mandatory content. The credits to be taken from the optional units remains the same. The qualification can still be taken as part of the Leader in Adult Care Apprenticeship Standard. A high-level mapping document can be found in Appendix B of the qualification specification. We also offer endpoint assessment for the standard to support the apprenticeship journey. As previously mentioned, the qualification now includes digital knowledge and skills both in the mandatory and optional unit content. I will explore this in further detail in the next slides, but first I will touch on the funding streams. As with the Level 3, Skills for Care will confirm workforce development funding. We have also applied for learner loans and we will look to communicate any confirmation of funding in the near future. Next slide, please, Hayley. We will now explore the digital content in further detail. The consultation has identified a number of digital knowledge and skills themes which have been embedded throughout the new qualification. We have added learning outcomes to the unit professional development in adult care, which focus on digital skills. These learning outcomes cover the knowledge and understanding of the development needs of the adult care workforce relating to digital skills. Learners will also be able to lead and manage practice to support the development of their own digital skills, as well as those of their team. The unit Continuous Improvement in Adult Care enables learners to identify where digital technology could improve or enhance outcomes-based person-centered practice. We have written an additional optional unit to provide centres and learners with an option to focus on digital skills in more breadth and depth. The unit allows learners to support the development of digital skills and lead and manage practice in relation to the use of digital technology. Our digital skills mapping table can be found in Appendix C of the qualification specification and will provide further guidance and details around which units feature digital knowledge and skills content. Next slide, please, Hayley. The current qualification will be withdrawn on the 31st of May and the new Level 5 diploma will launch on the 1st of June. I hope you found this overview of the new Level 5 diploma helpful. You can find further information and details on QualHub, which will include support materials such as a qualification fact sheet, the qualification specification, and a sample internal assessment task. Thank you for listening, and I'll hand now back over to Claire.
Thank you, Stephanie. Can we have the next slide, please, Hayley? Of course, if you would like more information regarding either qualification or how we can support you with your own curriculum planning, we'd be very happy to talk to you. We also offer a full range of further qualifications in social care, and more details can be found on QualHub. I do hope you found this overview useful, and thank you for listening.